Did you know that some common habits during masturbation after age 60 could actually be harming your circulation and weakening intimacy without you even realizing it? What feels natural and normal might secretly be holding you back from enjoying the full benefits of sexual health in your golden years. Welcome back to the channel, where we focus on health, wellness, and intimacy for people over 60. Today, we're diving into a topic that's often overlooked but incredibly important: masturbation. Yes, it's a natural and healthy part of life at any age, but there are mistakes many of us make that quietly damage our circulation and reduce the pleasure and connection we experience. If you want to maintain strong blood flow, sensitivity, and a fulfilling, intimate life, it's crucial to understand these hidden pitfalls. So, in this video, I'll walk you through 5 common masturbation mistakes after 60 that might be silently weakening your circulation and intimacy, and what you can do instead to protect and enhance your sexual health. Mistake 1. Excessive pressure and vigorous techniques. One of the most common mistakes many people make after age 60 is using excessive pressure or being too vigorous during masturbation. You might believe that pressing harder or moving faster will increase pleasure, but in reality, this can cause significant harm, especially as the body ages. As we grow older, the tissues in the genital area become thinner, more delicate, and less resilient. The blood vessels and nerves that provide sensation are also more fragile. When you apply too much force or rush through the process, you risk damaging these sensitive structures. Over time, harsh techniques can lead to micro tears in the skin and underlying tissues, causing inflammation and irritation. This inflammation narrows blood vessels and reduces circulation, which diminishes sensitivity and can even cause numbness or prolonged discomfort. In worst cases, it may lead to chronic problems such as erectile difficulties or reduced sexual responsiveness. The key is to slow down and use a gentler, more deliberate touch. Slow, rhythmic movements allow your body to respond naturally, increasing blood flow gradually without causing damage. This approach helps maintain the health of your nerves and blood vessels, supporting better sensation and intimacy. If you notice any pain, prolonged numbness, or unusual discomfort during or after masturbation, it's a clear signal to adjust your technique. Being gentle and patient with your body is one of the most effective ways to preserve sexual health after 60. Mistake 2. Neglecting proper lubrication. Another major mistake that many older adults make is neglecting the importance of proper lubrication during masturbation. As we age, the body's natural production of moisture decreases. This is particularly true for women, but also affects men, leading to dryness that can make sexual activity uncomfortable or even painful. Without sufficient lubrication, the friction generated during masturbation increases dramatically. This friction can cause tiny abrasions or irritation on the skin and mucous membranes. These small injuries trigger inflammation, which restricts blood flow and can lead to swelling, redness, or sensitivity loss. Using an appropriate lubricant is not just about comfort. It's a crucial step in protecting your circulation and preventing tissue damage. Water-based lubricants are usually the safest and easiest to clean, while silicone-based lubricants last longer and provide smoother glide. However, avoid lubricants with harsh chemicals, fragrances, or additives that can irritate sensitive or aging skin. Lubrication allows for smoother, gentler stimulation, reducing friction and enhancing blood flow to the genital area. This helps maintain the delicate tissue's health, making masturbation more pleasurable and supporting better intimacy. Mistake 3. Ignoring overall physical health and circulation. Masturbation is often seen as a purely physical and isolated act, but in reality, It deeply depends on your overall cardiovascular health. After 60, many adults face common health challenges such as high blood pressure, diabetes, or peripheral artery disease, all of which directly affect how well blood circulates through the body. Blood circulation is the foundation for sexual function. Without proper blood flow, it becomes difficult to achieve or maintain arousal, whether during masturbation or with a partner. Poor circulation means your tissues, especially those sensitive areas involved in sexual response, receive less oxygen and nutrients. This leads to weaker sensations, slower recovery, and can even cause discomfort or pain. Ignoring or neglecting these underlying health problems doesn't just impact your general well-being, but also silently sabotages your intimate life. If you don't manage these conditions effectively, the combined effect of diminished circulation and nerve function can reduce pleasure and intimacy. So, what can you do? First, work closely with your healthcare provider to keep your blood pressure, blood sugar, and cholesterol within healthy ranges. Incorporate physical activities tailored to your ability. Walking, swimming, or gentle yoga are excellent for improving circulation and heart health. Additionally, eating a diet rich in antioxidants, such as berries and leafy greens, and omega-3 fatty acids found in fish and flaxseed helps maintain healthy blood vessels. These small but consistent lifestyle choices support better circulation, which in turn enhances sexual function and intimate satisfaction. Mistake 4. Overdoing frequency without rest. Masturbation is a natural and healthy expression of sexuality at any age. However, after 60, your body's ability to recover from physical activity, including sexual stimulation, changes. It takes longer to heal and restore itself. Overdoing masturbation without giving your body adequate recovery time can cause temporary swelling, irritation, or fatigue in the genital tissues. This discomfort isn't just a minor nuisance. It actually leads to reduced sensitivity and weaker blood circulation in the affected area. When blood flow decreases, the pleasure and ease of subsequent experiences are diminished, making intimacy less enjoyable. Your body will give you signals when it needs rest. If you notice soreness, prolonged numbness, or decreased sensation after masturbation, it's time to slow down and give yourself a break. This rest period is essential for your blood vessels to relax and for any minor tissue stress to heal fully, so your sexual function can be restored to its best. The key is balance. Masturbation after 60 isn't about total avoidance or frequent overindulgence. It's about respecting your body's natural limits. Spacing out your sessions and allowing sufficient recovery time helps maintain healthy circulation, prevents chronic tissue issues, and keeps intimacy a positive and fulfilling part of your life. Mistake 5. Ignoring emotional and psychological factors. One of the most commonly overlooked factors that affects both circulation and intimacy after 60 is the emotional and psychological environment in which masturbation occurs. Our mind and body are deeply interconnected. Emotional stress, anxiety, and feelings of loneliness don't just affect our mood. They trigger real physiological changes. When stressed, your body releases a hormone called cortisol. Elevated cortisol levels cause blood vessels to constrict, reducing blood flow to many areas, including the genital region. This means that even if you physically stimulate yourself, poor circulation may undermine the quality of the experience. After 60, life often brings changes that impact emotional well-being, shifting or ending relationships, loss of loved ones, or social isolation. These factors can increase psychological distress, which can make masturbation feel less satisfying or even mechanical and stressful. To improve both circulation and intimacy, it's crucial to cultivate a positive and mindful approach to sexuality. Practices like mindfulness meditation, deep breathing exercises, or simply creating a calm and comfortable environment before and during masturbation can reduce stress and open up blood vessels. By engaging emotionally with the experience and relaxing your body and mind, you boost circulation and increase physical pleasure. More importantly, you strengthen your connection with yourself, fostering a healthy intimacy that's as important as any relationship with others. So, there you have it, 5 simple but powerful style tips that petite women over 60 can use to look taller, feel confident, and express their unique style with elegance. Remember, fashion is all about celebrating who you are and feeling your best at every age. By embracing vertical lines, choosing high-waisted and tailored pieces, opting for monochromatic outfits, selecting the right shoes, and accessorizing smartly, you can create outfits that truly flatter your frame and highlight your natural beauty. If you found these tips helpful, please give this video a thumbs up and share it with any friends or family who might benefit. I'd love to hear which tip you're most excited to try. Let me know in the comments below. And don't forget to subscribe and hit the notification bell so you never miss a new video with more style advice designed especially for women over 60. Thank you so much for watching. Stay stylish, stay confident, and I'll see you in the next video.